They don't know regeneration. So if you don't know regeneration, they're going to look for things that stimulate pituitaries, thymuses, growth factors. They don't realize when you artificially do that, the bump that the body takes from that. So I don't know.
Yeah.
These guys keep playing with that, and it's like, back up. You know, the intellectual mind. And that's the problem, is that they're so trapped in academics in the mind, it's like they keep seeking truth through creation. Mm-hmm. That's not where truth is.
Yeah.
You know, so it's a lost scenario for them. Here, we're pulling back, say, pull back. Take a grander view of everything, and then you'll see the truth of it all.
Yeah.
Instead of getting lost up back in what you state, growth. Yeah, if we stimulate those growth factors, then we can get this tissue to do this. And if we get this tissue to, this pituitary tissue, hypothalamus tissue to stimulate growth factors and whatever, you know, maybe we can get tissue to rebuild, you know, that sort of thinking.
Yeah.
When in reality, it's already set there to rebuild. It's just you have to understand the two sides of chemistry and energy and all that other stuff.
And just the environment that you're creating around those cells.
Yeah, I mean, you have to understand the science of it.
Yeah.
You know, they say allopathy's about science. Is it really? Then where's the science to you guys? Mm-hmm. And the theories you have are so flawed. I remember we were talking about that chemist that was in here, and I thought he had alkalosis for all this time. Fought me over that until I got him sweating, and he started pH papering himself, and he goes, you know, so where's the alkalosis, man?
Mm-hmm. Well, the one thing about the pH test, it can tell you the fluid. Mm-hmm. of the GI tract, or if you're sticking it in water or sweat glands or whatever, but it is not telling you the interstitial fluid.
Oh no!
The pH of the interstitial fluid. Yeah,
see now that, and I let me guess that in the future, when 100 years from now, maybe when they kind of get this, not to slam them, but I'm going to slam them because of what's going on here, but they'll find a way to run a needle interstitially and pull that out and test it.
Yeah.
You know, it's like a biopsy to a tumor. When we know that, leave it alone, because when you open it, that explodes the problem.
Well, it's the same when you look at any plant. By the way, hello everyone.
Oh! Hello, my dear friends.
So,
we are...
we're just kind of chit-chatting here.
Chit-chatting on the old lymphatic highway.
Yes. But when you consume a fruit or a vegetable, that has everything. It's got amino acids, it's got your vitamins, it's got your minerals, but they're all in the quantity or amounts that are needed to buffer each one.
Think about that. The ratio, the chemistry in, is uniquely set by the divine to have the flavor, the look, the color, the music, if anybody hears the music of the plants, and all of that is designed in that friggin' chemistry.
Absolutely.
You know, when we're talking about God and you want to know God, and man tends to seek through the physical self something outside of himself, right? So I'm saying, you know what, just like we do in health, tear it apart, all right? Take the body, tear it apart. What do you got? You got a bunch of cells, right, and two fluids, right? Take the cells apart. What do we got? We got a bunch of atoms making themselves into substances and compounds and things like that, right? That's what we're doing, right? Yep. So then we take that apart. We take the atoms apart. Now we have subatomic particles, electrons and protons, right? And all the subatomic particles. Yep. And when you start tearing it all apart, then you reach quantum physics that says at a certain point things just become pure energy.
Yeah.
Well, now wait a minute. If we're looking physically for God, how come when we tear down creation, now we're into pure energy? What is energy? So then when quantum physics comes out and says energy is awareness, and God is omnipotent and omnipresent, that means something is everywhere in all places at all times, and what could that be? So when quantum physics defines that energy as intelligence, that means that what we're talking about is everywhere in all places simultaneously. The Bible tells us that, and tells us, you know, these sort of things. It's like, wow. So when you tear it apart, you realize you're going back to awareness. Think about that in the plant. When you're eating those foods, it's not just the chemistry you're eating. You're eating the uniqueness of why that plant was created. And that,
you're eating the life of the sun.
Exactly.
Photosynthesis. You are eating that with every bite you take. You're pouring that life into the body.
The consciousness of the plant itself, you're consuming, or the fruit, you're consuming that consciousness. What does that mean? See, because we're looking more mundane, more chemistry, more elemental. That's the least part of what you want to look at. Everybody's seeking that which is God. Well,
Well, this is the problem. We try and put God into what we know. And
Boxes.
we experience that through what we see, what we hear, what we taste, what we touch. And if God doesn't fit in that for us, we
Good point.
start guessing.
Exactly. Good point.
And the problem is, God is not guesswork.
Exactly.
So you have got to be quiet. You've got to be still to understand and get out of that thinking, the physical
The
thinking.
preconceived idea of what it
Exactly.
is anyway. If you want to know what anything is, you don't want to enter it. And this is true in the study of science. And that's what I tell allopathy. If you want to know what life really is, don't enter it with preconceived ideas, because you've already set your whatever it is, whatever study you're doing, you're setting up to fail. And
Those
that's-
expectations probably won't
Exactly.
be met.
Well, look, 60 Minutes. Remember I talked about that? 60 Minutes did a study on double-blind studies. So they did a study on double-blind studies, and this is what they found. This is 60 Minutes. You can Google them. They found out generally who pays for the study wins the outcome of the study. Most studies are done in little doctor's offices in Podunkville, and done with people that shouldn't be in the study. This is 60 Minutes that uncovered all of this. So here we are as a society believing these guys, saying, oh, we've done all this and done double blinds and all this crap, and it's all a joke. You know, it's amazing what's out there that we believe in. So if you want to know truth, you just literally can't believe in anything. You have to pull back and just watch so you can see what it really is.
Observe.
Yeah, because if you use the mind, thoughts are conditioned. Well, everything you went to school was somebody else's thoughts. When you study books, what do you think? Studying someone else's thoughts. I get the 4 hours. I get the reading, arithmetic. I get all that. But when you get into science and stuff, how much of it is really true and how much is theory?
Exactly. Because sometimes you may be doing a test, but you may have all of the questions wrong
Exactly.
of what you're trying to accomplish.
And what you're looking for, the outcome. It shouldn't be anything. Science is an observed study, meaning no thought or preconceived ideas involved. And then you get to see the whole picture. Some people think that's an unconscious state. That's actually a more conscious state.
Yeah.
You're more aware the less you think than when you think. Thought takes away your awareness into those thoughts. You've been sitting there daydreaming before, just lost in a drama of some sort, you know, and then pretty soon, yeah, same thing. You were unaware.
I gotta focus on my
I
driving.
gotta focus on my driving. Yeah.
That's not the time to do that.
No, you in particular.
So,
Yeah. I tell you what, it's beautiful to see our group out there and the way they're healing everybody and the way they're picking this up. I'll put our group out there in front of anybody because they're getting the lymph, they're getting the acidosis, but why wouldn't you?
yeah.
I mean, when you understand the simplicity of things, one guy said to me the other day, he said, this is too simple. Can't be true. I said, truth is always simple, man.
Yeah.
The complexity is the mind.
Yeah.
It complexes, confuses, separates, isolates, and pretty soon you don't
Well, look
know.
what we've done with our laws and our government.
Same thing.
We've complicated everything.
Complicated everything. Same thing.
We have 92 laws on how to cross the street, but
And that's sad. You know, and like in New York City, there's a law against sitting on a milk carton. There's a law against riding your bicycle without your feet on the pedals. There's all these little quirky things. And it's like, man, that board that he has to pass these little bullshit things like that. and of course, the more laws a society passes, the more negative it becomes. See?
Yeah.
And that's what happens. There's so many laws, and you see how negative things are.
yeah.
Man needs to learn ethics.
Man always tries to manage everything.
I know.
And look at how
True.
that is turned into the allopathic. We take disease and we don't try and fix it. We try and manage it.
Exactly.
Because we
Manage
feel
care.
like we have to manage everything.
Exactly.
Including government and people and sicknesses and disease and prescriptions. I got a lab work the other day because my doctor told me I needed to get a lab work to get the insulin that I needed. And yes, I am still taking insulin, but a lot less, and it's getting less. But that lab alone, $1,100.
What?
Just so that he could say, you do need insulin.
Are you kidding?
Yeah.
$1,100 for the lab work? Well, that labs are going up like crazy. You used to get a
It's
nice
unreal.
lab work, $200-300. You get a full lab book.
Look at that.
CBC,
I don't even want to pull out just one specific, but you look at the elderly that are on Social Security. How can they afford that?
Was that his own lab?
Yeah.
Yeah, that's it. That's that
Yeah.
doctor's hospital up in Sarasota?
There's a couple of them.
Yeah, all right. So that's why, it's all about the money.
Oh, I know it.
Remember another 60-minute special, head of the AMA said, let buyer beware when it comes to the medical profession. Let buyer beware, not poor patient, suffering patient. Oh, you took off the wrong foot? Let buyer beware, man.
Yep.
You mean that pharmaceutical killed my husband? Let buyer beware, man. That was the head of the AMA to Wally Safer, one of the 60-minute guys, in an interview, and it's like, what?
Mm-hmm.
That buyer beware. And right there it tells you the consciousness. This is the head of the AMA, so that, you know how the head trickles down to the feet?
Mm-hmm.
Yeah. Mm-hmm.
Well, my doctor and I are going to have a conversation because that's not happening again.
Yeah. That's
So
insane.
many people are afraid to go to the doctor.
God.
They're afraid to go and get this test or that test.
Do you
And
blame them?
not a bit. But they're telling everybody, you got to have this to get this.
Yeah.
It's almost a blackmail game.
They've got it all. They're getting it down. And now there's so many specialists in the field, you just like go way out there. I remember one guy I talked to, and he was a oncologist, but he was a specialized oncologist, and he only treated, because he can treat, one type of cancer or two, and that's all he could treat. And I'm going, are you kidding, bro? He goes, yeah, that's all I can do. And I'm going, wow, you guys are really isolating yourself big time. It's like they must be that busy. And he didn't even know. I was asking about the pH of his chemo, and he had no clue.
I've got a picture on my phone right now of where chemo was spilt on a hand.
You see that?
And it is completely burned. Mm-hmm. And can you imagine what that's doing to the inside if that's doing that to the outside?
I had to take IV therapy to do cardiac work, and so I took there's an advanced life support thing. It's really a booger bear because it's you got to know all your cardiac meds, you got to do your intubations, you got to do everything. You got someone down, you got to get them up. That's the advanced life support. But I tell you what, when I took IV therapy, they show you pictures. And you glove up, and they tell you don't spill it on the skin. Mm-hmm. So that's when I was asking the nurse, and I knew her already though, and I said, but skin's made of cells, right? And she said, yeah. And I said, but you want to introduce it vascularly, and what's the vascular walls made of? And it's obvious because they don't introduce it anymore down here in the subway, because you see these subclavians, this collapses.
Now they're putting it right in by the heart.
The aorta. And there was a hospital administrator, this was about 10, 15 years ago at one of our classes. He said in front of the whole group, he said, I know a statistic I bet you don't. Right in front of the whole class. And I'm going, wow, what's that, man? Hospital administrator, right? He said, what's the percentage of deaths from aortic aneurysms? Because remember, what does the body use to buffer acids besides bicarbonate? Calcium. Where does it get it? When you're pouring acid directly, everybody who did that ought to go to jail. That's giving someone Drano. Is there a law that says some people can give others Drano? Because that's what it is. Yep. So they're pouring this acid right in the aorta, so that's going to steal that base, it's going to steal that connective tissue. Yep. It's going to rob it blind, especially when you pour juice in it. So then you're going to have an aneurysm. Well,
what happens when acids hit? It takes a direct hit from that acid, and things harden.
Oh, yeah.
I don't care if it's connective tissue. I don't care if it's a sphincter. I don't care if it's a flap, a valve, you name it. It's going to lose some of its flexibility.
So it's going to pull the calcium to buffer. When you have an acid, you need an alkali to stop it, right? It's just chemistry. Chemistry, guys. So pouring in an acid, what are you going to lose? An alkali, an electrolyte, all right? So what's the most abundant electrolyte? The body's not going to pull something that's calcium. And there it goes out of the connective or bone or teeth. And you wonder, why are my teeth? Oh, the bacteria did it.
Yeah.
So how they medically blame nature for their problems?
Although I will say the last dentist I went to, he said many people say that this is bacteria. He said it's the acids.
Thank you. I finally got mine saying the same thing.
Yep.
It's like, thank you,
so
Lord.
There
we
are
are
some
having
that
an
are
impact.
learning. Yep.
Through the years, we've all had an impact on changing the consciousness of these guys. Get
Yeah.
into the reality of chemistry here, not nature. Nature did it.
Exactly.
Yeah, I love that one. We've been blamed for everything anyway. You
I know.
And yeah, we've been cleaning up their messes. I've been cleaning up their messes for almost 50 years. Holy
Yeah.
crap. I know it. You know, even though we sound like a broken record when we talked about the lymphatic system, the jewel of the Nile, the jewel is learning that system.
Yeah.
You learn about the lymphatic system the way we teach it. I'm going to tell you, you're in. You're in. You've got it. You know the two sides of chemistry and about the lymphatic system and kidney filtration. I don't care if you don't know anything else, you're in.
Yeah.
And once you get on the fruits and you start using, you're just using the botanicals to assist or increase the power of detoxification and to enhance your organs and glands so they function better. That's all you're using them for. They're not like miracle. Oh yeah, they're totally miracle things. But you know, I've seen things do things, herbs, it's just like, what?
Yeah.
You know?
I mean, once you start playing with the herbs, you just fall in love with them.
Oh
They're
my
just,
God.
they're just,
Because there's an herb for everything.
yeah.
If you're a healer, there's an herb for everything. There's an herb to stop internal bleeding. There's an herb to stop spasms and convulsions. There's herbs for these things. And it's like there's herbs to enhance kidney function, herbs to enhance hepatic or liver functions. There's herbs to clean up the lungs and harden mucus. I mean, it's like there's herbs that pulls tumors right out of the body. How cool is that?
I think I've shared this before, but in case I haven't, I was talking with a doctor one time. He was a cardiologist, and I was talking to him about some herbs, and he goes, about every prescription that we advise or recommend or whatnot came from an herb at some point. He said, we just perfected it. And I started laughing, and he looked at me, and I said, no. You can't perfect on God.
Thank
I
you.
said, that's why you have side effects and we do not.
Thank you. You know, that is really the important thing. Besides, they only go in and take the active principle out of a botanical. They don't have the synergistic effect of the botanical, and that's where they go wrong.
Mm-hmm.
They don't understand the synergistic effect of chemistry. And the vitalists say, we'll just take this and add it to this. We'll just take calcium and make a supplement for you. We'll isolate and separate and potentize. And it's like, no, you can't do that. And you should have learned by now, with the years of pharmaceutical deaths and maiming humans with pharmaceuticals, you should have learned that. And they haven't learned that. And it's like, well, one day the karma's going to slap hard because you can't keep, God doesn't work only in one direction. This is duality. So all this negativity is going to shift back. And all of you guys are responsible for helping that shift back. And then shit's going to hit the fan. But it has to. This is how you grow and expand.
Yeah, absolutely. And the one thing that I want to talk about, so many people come into our office scared to death of going back to their doctor or talking to the doctor or the pressure the doctor is going to put on them. Take your power back.
Thank you.
You walk in there with confidence. You know more than half
Thank you.
of what most people walking into a doctor's office know. And if your doctor gets upset because you start asking questions, it's time to find a different doctor.
Yep.
Remember, you hired them. They didn't hire you.
Exactly.
I've fired numerous doctors before.
Thank
I've told them, I'll never see you again. Or I'm going to do what I'm going to do and I'll come back and see you and show you that it works. At some point, you have to walk in the authority that you already have, the knowledge that you already have. You know what? The doctor recommends something you don't know. Say, I'll think on that. I'm going to do some research on it and I'll come back and talk to you about it. Yeah. Go do your research.
Yeah.
That's
Smart.
That's what it's all about.
Best point you could have made. Do not fear another human. Mm-hmm. These are just other humans who studied intellectualism to the point that they don't even know. So you're talking to an individual that doesn't know the cause of any of your suffering, but they have symptoms related to pharmaceuticals, related to diseases. Mm-hmm. That's it. So a lot of medical doctors, I guess you guys probably already know this, but they go to their office and look up symptomology to see what you're having. You ever hear of that? Oh, yeah.
Well, what is all disease?
Oh, yeah.
You go to a doctor, you have 5 different symptoms, he puts them in, and it spits out a
He's in there looking up what it is you have through your symptomology. Ridiculous.
Diabetes is just this list of symptoms. Heart disease is this list of symptoms. RA is this list of symptoms. I would much rather work with the systems of the body than the symptoms of the body.
Perfect. You know, again, you should never fear someone that doesn't understand what you need.
Yeah.
Or anyone ever. Because if it's a true healer, they're going to sit you down like a bro or a friend and say, this is what your problem is. This is how you get out of this. If they know, if they're worth their weight. If they're not, you know, they rule by fear. And it's just what you said. So many people fear. I don't want to tell my medic, why not? Yeah. These guys need to know. These guys are there that can harm you. You think not. You go in and trust them all. But unless it's emergency surgery or the ER, you better be very smart in what you let them do to you.
Yeah.
You know,
well, in Scripture it says, my people die from lack of knowledge. And that's what we're trying to provide, is the knowledge of how you can take your power back, how you can get your health back, how you can figure that out and understand the body.
See, one of the problems that you're going to have is your knowledge base is growing listening to these videos, because we're feeding you as much as we know, and in a balanced way, and educating you. I've been trying to bring you along all these years, spiritually and through science here, so you can get that. And I've had people walk up to me, two sides of chemistry and the lymph system, right? And it's like, yeah, I said, we get it. You know, the simplicity of the thing.
Yeah.
You know, it shocks the intellectual mind, and they can't handle it. Good. It's time to get out of your mind anyway if you want to be free and understand the divine. You can't just understand the divine through thoughts. That's ridiculous.
Well, I was talking with someone the other day, and they said something about scar tissue, and I said, well, this protocol can break down scar tissue. Are you serious? And I said, well, this is what we don't... Robert has said this over and over and over and over again. Water is the universal solvent. When you have blockages, when you have backed up obstructions within the body, scar tissue, all of this stuff, water's the... Hydration. Where's the best way to get that hydration? Through your fruits and vegetables. 60 to 90% water. And your fruit is a higher vibrational than even the vegetables. Why do you think we push the fruit so much? Because that's what's going to break down those obstructions. That's what's going to break down that scar tissue. You have scar tissue. Most people that have hardened areas and things like that, it is because of scar tissue that's blocking it. It's blocking a lymph node. It's clogging something up. It's not just scar tissue, but the hardening of the lymph or the hardening of the mucus, that has to be broken down.
Well, what side of chemistry causes the hardening?
Exactly.
See, and that's all in chemistry. We know that. So how can someone say alkalosis when things are showing cationic environments instead of anionic? And it's like, you're a chemist, you should know that. And it's like, oh, you know, so you bring up a good point.
So just, you know, we love to talk about the cases that 40 days of grape, breast cancer gone, 30 days of lemons, this is gone, that's gone, this is healed, that's healed. But the average person going into this, they're looking at a good year or two of cleaning before they start building up and that kind of thing.
I would say so.
So, absolutely, especially when you see some of the eyes that are coming in. And people get stuck on the emotional. Remember, we just talked with the young lady that 101 days free of insulin and one family argument threw her back into taking shots again.
And it just shows you the power of emotions and the effect on the adrenal glands and all, and the sugars and metabolism. It won't just be the blood sugars; it can be all the chemistry there.
Detoxing isn't just about the body; it's about the physical and the emotional and the spiritual. And that's why the spiritual tends to come to light more when you're detoxing, because you start getting rid of the emotions and the things, the thought processes and the beliefs that are obstructing you. And that's, you know, it does it for the body, it does it for the emotions, and it does it for the spiritual.
You bring up an excellent point, hydration. Hydration isn't Gatorade. Gatorade has a pH of, according to the School of Dentistry, a Minnesota School of Dentistry, Gatorade has a pH hotter than Coke. Coke has a pH of about 2.9, if I remember, and Gatorade is down about 2.7, 2.8. That's hot.
I think they changed it because they come under fire a lot for that. Especially the sports people were getting upset. This is
Well, I
supposed to be
would.
hydrating.
Yeah, but it is acidic, I can
Yeah,
tell you already.
it
So it's
is.
not a hydrator.
But I think they raised that to 4.4 or something like that,
Well,
but I'm not sure.
Yeah, let's look and see, because I tell you, but it wouldn't matter. It's still acidic.
It's still acidic.
So it's not a hydrator, period. But you can feel it when you have Gatorade. You can feel the acid in your stomach immediately. So it's not a hydrator. Why is alkaline chemistry a hydrator? Electrons. Your electrons in the orbits. Remember, electrons are alkaline, your protons are acid. So you have that same scenario going on in the subatomic particles. You have the same scenario going on all in creation, where duality rules the order of the day, no matter how nano or sub-nano you're at, or how huge you're at.
Right.
Duality is the order of the day. There's two forces at work interchanging with each other. Magnetically, creates magnetics, movement, form, all of that. But when you break all of that down, what do you get? See, and that's chasing God back to its unformlessness.
Yeah. Absolutely. Well, I am leaving you in amazing hands. I have a session, so I just wanted to say hello and love you.
Love you, honey.
Have fun.
Love you, love you. I'll take care of these guys.
All right.
But I tell you what I'm going to do is I'm going to grab some of these, because these were pretty bad. How's my dear ones doing here? Can I just do this a little bit then? All right. Oh, Marcia. You know, that was my sister's name, Marcia. Yeah, she didn't like it, but I didn't find anything wrong with it. I liked it. Kidney cyst, 6 inches by 9 centimeters, removed with half my kidney. Well, you know, again, look at that. Even the kidneys are having trouble lymphatically. And I think part of the filtration problem is the swelling of the kidneys, because remember we were just talking about water and hypertrophy, enlargement, swelling. And of course that's what's trying to do. The body is bringing edemic changes to the area to use the solvent side, to break up this cationic agglomulation. You know, when things become acidic, it becomes hardened and agglomulated, meaning locked and hardened. You see that in tumors all day long. That's what you don't want. The harder, the not so good. But remember regeneration, Marcia. The body loves to regenerate. If you have half a kidney still there, I'd be 100% fruits, berries, and melons, and you couldn't take me off of that. And then go after the rest of your body. Go take the kidney formulas, go into the adrenal glands, go after the lymphatic system, although I'd probably only use one lymphatic system for a couple of months until I got everything kind of opened up. Probably start out with one, very gentle, because your fruits are more lymphatic herbs or foods. Love, love, love to all of you. Keep up the wonderful work. Love you too, honey. I am 48 years young. I have been through hell and high water with allopathy doctors. No kidding. That's why I try to have a favorable view, because I have good friends that are MDs, but it's difficult when you see what we see here. If you're out there in life and you just hear a story here and there, that's one thing. But we have hundreds and hundreds of people every day sending us pictures and stories, and that's why we sometimes take a hard road at not doing well emotionally here. Pretty tough. A lot of problems out there, and it's from the allopathic community. It's hard to be overly respectful and nice when you keep digging, especially when they've leveled accusations and called us all kinds of names through all these years, been responsible for a lot of arrests, things like that, taking the children away from parents. Hard to respect allopathic physicians. Sorry. Change your way. Many surgeries. Many surgeries, many diagnoses. Yeah. Not funny. God, not really, but many medications. Oh my God, honey. I have never been blessed with good health and have struggled all my life with just trying to feel good enough to function. And you know what? She brings up a good point. There's a lot of people like that, and this is particularly more and more true with the young people, guys. I mean, our class is just full of 30 and 20-year-olds. And these are suffering individuals, and there's an obvious reasons. We've treated, we've intellectualized, we've academicized things that are not even true. So we really need to find the truth of life, and you're now partaking into that and learning how to get yourselves well. You just have to take back on this road of regeneration. Regeneration obviously is going to be on the alkaline dominant side. But you got to remember, plants have awareness to them. Everything does. And we talked a lot about plant awareness. And you have to add that in. There's a reason that plant was created. It has a mission, and that mission is interface with you or your body, whatever it's designed for, whatever tissue it's designed for. I mean, it is so cool to understand the divine at another level. You know, I have a slight scoliosis in my upper back. Okay, a C curve between my shoulder blades that causes me a lot of grief every day. So you're talking somewhere between thyroid and lung problems. So you really want to look at that. Remember, your vertebrae is kind of going off like this, blood, nerve, and lymph, kind of like this. So trace it out as you go down your spine. You know, from your upper C's, you're all up in this area, of course. You know, with the trigeminal neuralgia, that's like C2, that sort of thing. So we're up in this area. But again, to have scoliosis, you have to have acidosis. All right? To have scoliosis, you have to have acidosis. To have acidosis, that means you have to have stagnation. To have stagnation, that means there's only one system that deals with the acids, and that is the lymph. So you have to have stagnation of the lymph system. Well, acids bring stagnation very easily. That's the nature of acids. Stagnation and agglomeration, and then just fries up the stuff. Breaks it apart until it's nothing left. Deterioration. The end result, or what they would call cancer, of course, but just deterioration. You know, after a while, what do you expect? You know, you stick your finger in batter acid, after a while, if you don't pull it out, don't be upset if you pull it out and there's just bone left. Causes her a lot of grief. A naturopathic doctor helped me many years ago with my pancreas because I used to pass out occasionally from what I ate. Point is, yes, I am blessed with a healthy body, but I am a fighter, and I keep fighting allopathic doctors because whatever is wrong with me at the time, they have always made everything worse. I have tried many natural holistic ways to heal my body on my own. I finally kicked depression's ass. I can tell you're glad about that. To the curb with the master cleanse. That was a true turnaround in my health. You know, I read these sad stories all the time, but notice that when you start moving toward the raw, and the food is more designed for the Homo sapien, like the fruits, the berries, the melons, and not the vegetables, but the vegetables even. The vegetables can make humans so much healthier than what they are. But when you kick it up to the food your body's designed to eat, the fruits, it's just another level. Having a good level of fruit, though, that's really tough. Oh, let me see here. In 2017, after finally feeling so good for so long, I got the rug pulled out from under me, and I had half of my kidney removed because of a huge, it was bigger than my kidney, cyst. It was complete abdominal surgery. It was the most traumatic, I bet. I bet your adrenal glands took a dump, and they were already dumping. Thing I have gone through yet. I can't bear to go through it again. Since finding you on YouTube and learning about the great lymphatic system, don't it make sense? It starts answering all the questions, and then you start, and of course your kidneys, once you fix all of that, and you get your filtering, but now you have half a kidney. So now you want to get that kidney to regenerate. You know, use kidney formulas, and this is where I would use a kidney glandular. I really would. I would use kidney tissue. And use a glandular of kidney. I would say 1 or 2. You've got 2 nice kidneys, or 1.5. I would probably use 2 capsules 3 times a day for a while. I'll use the kidney herbs. Be gentle on the kidneys. No proteins. You know what people don't realize, proteins are hard on the human body. Not the blessing. They're hard. That's why in foods, they're the least. That's why in mother's milk, they're the least. We've been lied to. I have learned that my kidneys are not filtering. Yeah, that's why the cyst on them. You know, I mean, when you don't filter, where are your wastes going? It's a good, legitimate question. When you're not filtering, and it's a question, look at the professor I was talking about from Rochester, who was talking about sleeping on your side so your brain could drain lymphatically better. Now, for this gentleman to jump on this early is pretty good on the lymphatic system, because that means there's people looking and understanding this thing and want to understand it. But that's university science, not medical science. Medical science is very conditioned, monetarily focused. You just go on a million things with that one. But university science is more like, oh, let's see what we got here. So you know you had the weak kidneys in the first place, why the cyst on them and all that sort of thing. So just go after that. Go after your adrenal glands aggressively and your kidneys there. I am terrified that the cyst will grow back because obviously whatever made it grow there has not been fixed. Get your kidneys filtering. The word of the day for you, get your kidneys filtering. There's nothing else. You weren't filtering, and therefore your kidneys themselves. And you could have other cysts in the body and tumors you don't know about, honey. See, don't, just because you don't feel anything doesn't mean it's there. You can wake up one day and have a baseball-sized tumor easy anywhere. You know, they don't always cause pain. So, probably been there years. So, you know, you can't beat yourself up with that. You're in a body right now on a planet far, far, far away, so to speak. But it's enough to say that this is a level of creation that's needing to grow and expand and work itself out of some of these lower, very negative levels, and that's what's going on, I suppose. But it's just a body, so remember that. You're not your body, you're just using it. So separate yourself from your body, but to have fun, get your body well. So go on a regeneration road. That's what we're on, regeneration. And if people don't believe it, then let them go fly a kite somewhere. You know, we'll regenerate ourselves. But it will grow back on the other part of the kidney that they left, because they, you know, just like in a breast, you can have a lumpectomy and then pretty soon here's another tumor because you didn't fix a system that's down. Like Marcy said, systems. We teach systems here. And the lymphatic system is a huge baby. Huge. When I asked my surgeon what causes these cysts on kidneys, he said, I have very bad luck. Yes, he actually said that. Case closed. My case is closed. Thank you, honey. Just verifying what I'm thinking. Thank you. That wasn't me that said that, but it's true. If you do not understand the lymphatic system, then you can't explain to someone what cysts, boils, pimples, and the like are. Tumors and things like that. You don't know what they are. You don't know what they are. In order to fix my kidneys, I need to start on your herbal remedies first. And I would do a kidney glandular, but to diet, uno number uno. First, I am afraid of detoxing with only one kidney, since two of them couldn't handle what I did with the master cleanses. You got to get your kidneys filtering. Doesn't matter what cleanse you went on, you got to get your kidneys filtering. The problem with that is, it can take a little while. So you want to use a glandular, you want to use some herbs, you want to use your master cleanse, you can use your lemon juices or go on a grape diet. If I'm you, I'd be on a grape diet right now, honey. I'd put myself on the 10, 20, 30-day grape diet. If you want to throw some lemons in, go ahead. But you got to get yourself filtering. Don't beat yourself up. That cyst that big's been there for years. You didn't just grow a 6 by 9 inch cyst. No way in heck. So you give yourself a break. Don't get upset. Just realize that you got to detox yourself. You got to get your kidneys, and don't be timid about it. Oh, they might not. Go after it, because you don't have a lot of time to wait sometimes. And if you just remember that you just saw in your kidney what could be happening all through you. These kidneys control a system that's what we call systemic, head to toe. Side to side. Right kidney, right side, left kidney, left side. So don't get upset. You now guys are learning the truth of these things. And, you know, I've been teaching it for years and years. It's just that I'm one guy in the wilderness, and now We got all of you guys. And I tell you, people are learning. And finally, you're helping these people find their truth. Thank friggin' God before the surgeon destroys the body. But don't be afraid to take off when you're in trouble. Don't be afraid to do that. You can take it slow, but taking it slow, the big thing is stay away from protein. Stay away from beans, grains, meats, dairy products. The 4 big no-nos. Stay away from them when you have kidney problems. And most everybody has kidney problems. The one thing you don't do with kidney problems is proteins. Acid ash foods are a huge no-no with kidney or any problem, because you're just going to exacerbate the problem because you're on the acid side to begin with and you're staying there. Well, if no one ever told you there's another side of chemistry that's a healing side, let me tell you. Back in 2010, I did 2 master cleanses within 3 months to try to clean up my system after experiencing a horrible mental breakdown. Well, I think you're in the right focus with the master cleanses in terms of detox. I like that, but maybe shift off of that. It's a very aggressive. Get down a little bit to the grape side. It's more harmonious, more emotionally stable, at least of the lemons. Lemons are rippers. But go into your body, use the herbs, use these botanicals, upper circ, brain and nerve. You said something here about mental problems, and you said something over here about scoliosis. So what's the tie in there? And then you also said that you kick depression in the ass, right? So what's the tie in there? Yeah, I know, all you guys are so good, you already know the answer. Parathyroid, big time. And remember, the old pituitary could be sitting up there too. So parathyroid, honey, that's in your face. So Master Cleanse won't fix a pituitary or parathyroid necessarily. It can by removing the lymph and getting the lymph hydrated and moving out of there and getting that suppressive action of acids out. But that's going to take a while to get all the way up here, and you already have kidney problems and not filtering. So, I would definitely bump up on a parathyroid for me. It'll actually help regenerate the kidney as well. I'd go after, my whole thinking on your part would be regeneration of of your body and the kidney. And where else are you going to go with that? So to do that, you have to get on raw foods, not cooked dead foods, and away from acid ash foods. Period. But you have enough problems and you're a strong woman from this. All these years of problems have made you a strong soul. So you're just learning the truth, another higher step. Take it. Take it. We're introduced to higher steps, and then take it. They diagnosed me with, listen to this, they diagnosed her with bipolar, anxiety, yada, yada, yada. So what we've got is parathyroid and adrenals. Parathyroid, depression, adrenals, anxiety, bipolar. And it's just that you have multiple glands down. They make you think everybody's mentally ill with these problems and stuff. It's biological in a lot of ways. So you want to fix that. And that ties in again to your scoliosis and everything else that's going on here. So go after the parathyroid for your depression, go after the adrenals for the anxiety, and yada, yada, yada. And get her done. I don't believe them then, and I don't believe them now. I have done a master cleanse every year since I helped keep depression and associated symptoms away. But you're having to do something like that to do it. You want to enhance the function of those glands. I would. And it could be, if you're short or tall, it could be pituitary. Get a picture of your eyes, look at your lymph system, look at your pituitary, look at your bowels. Take a look at your body. The eyes are the magic. They're the windows within. It has worked, but then I got the huge cyst. Now you've been developing it, honey. The same reason your body's going down. The one system that takes the body down is the system that deals with acids. The sewer system can take any house down. Would you not agree? If you don't, just let your septic tank back up in your house for a few days, if you can last that long. Yeah. So sewage backing up in any house would be, get out of the house! But since most people don't know how to body traveling and they're stuck in this house, you better clean it up. Could get pretty stinky and nasty. I fell for the fear tactic. You did. You did. It showed you were emotionally weak, which is the adrenal glands, and you did. You hit it on the head. You did fall for the fear. I would have not have jumped and had my kidney removed. I would have went after that aggressively with getting the kidneys to filter. It's right there, and it'd come out pretty nicely because it's just a cyst, and it would have come out nicely for you, or popped. You could have went to Dr. Pimple Popper. Let me see here. A fear tactic of cancer and went for the surgery. Remember, cancer is just damaged cells. If you have some damaged cells, detox and let the body get rid of them. See, the body can't get rid of damaged cells because of what reason? It's in their A&P book, and they should know this. Because where does the body take the damaged cells? To the friggin' lymph nodes. Why? That's where the macrophages are. That's where the cannibals are. I mean, that's in A&P. Hello? Anybody connect dots? So, you got to have a pathway open to that lymph node. Well, the problem is when you damage cells in your body, it's the lymph system doing it, and the path to the lymph node is already closed. That's the problem. So we're coming and opening up that pathway so the body now can clean this area out through the lymph nodes and then through the kidneys or skin. Make sense? Makes sense. Medical doctors, the body doesn't get rid of metabolitic waste esoterically. Thank you. So even though you might not have been taught the truth, open your consciousness up and look at this and you'll see the truth. Sometimes it's better to see things for the truth than to read about them. Okay, so if I had known about you before, I would have come straight to Florida and pounded on your door for help. Yeah, but you can't regret that. I have to say, you can't regret anything. It's just a body anyway. You're really focused now. Get yourself focused. See if you can regenerate the rest of that kidney. Get it filtering so there's no more cysts popping in your body. Remember, your thoughts just locked right there at the problem. But that problem is systemic. So better get with it. But I didn't, and I have been so confused about why this has been happening. Don't be confused, honey. It's happening to everybody. Boils, pimples, styes, tumors, cysts. Hello. Rosacea. Keep on going. Eczema. Keep on going. I mean, this is all the same sewage stuff that's not getting out of the body. If you don't get sewage out of your house and in the ground so the microbes can work, well, we could blame the microbes. Was the cyst full of toxins that my body was trying to get rid of during the master cleanse? Honey, that's a pocket of acid slurry. And just pop, you ever have a little cyst grow on your fingers or anything? Or on your skin, a little pustule? You pop it, you get that clear fluid out of there? That's just acid lymph. But why would you get one then? So if you see something that can't get out of the body, that means there must be an obstruction. If you see something that shouldn't come out the skin, should go the other way, maybe the other way's blocked. Think about those things like that, because you'll never see a symptom if everything is moving appropriately. If your three major flows of energy in the body is moving appropriately, you're not going to see symptoms. What are the three main energy flows of the human body? Blood, nerve, and what's the last one? Lymph. Blood, nerve, and lymph. Those are your three main energetic flows of the body, and how cells touch the energy of life one way or another. Or I'm just a cell sitting in a space by myself with spaces around me. Was a cyst full of why did the master cleanse not kick my kidneys into working? You could have genetically weak kidneys. You could have a cyst on the kidney means you have a lot of weakness in that kidney. I've had a cyst on my left kidney. So, I mean, it's just the way we are and the way we were raised with milk drinking and acid ash foods and things like that. We literally beat up our kidneys. So let kidneys be on a banner flying through the sky. Work on your kidneys. Every medical doctor in the land, every naturopath in the land, every herbalist in the land, every osteopath in the land, every chiropractor in the land, every massage therapy in the land, therapist, every acupuncturist, all your health modalities should tell you about your kidneys. Or were they working and the cyst is caused by something else? You're not filtering, remember? You told me that. Very afraid to move forward with any kind of detox until I understand why that cyst was there. Well, you're asking a ridiculous question. Why is the tumor there? Why is a boil there? Why do I have friggin' pimples all over my face? Look at the foods people eat that causes all the congestion and the compromising of the immune or the lymph system. I mean, don't wonder why that cyst is there. You're just in line with millions of us on the planet that have the same problems because of the same lifestyle, eating the same friggin' crappy foods and breaking down the human body. It's chemistry, and we've been playing in the wrong fields. So if you're playing in the fields of dreams over there and your body's breaking down, would you walk out of that field and go into another one? No, because it's diseases. It's nothing you're eating. That's the biggest lie ever perpetrated. So keep eating the way you're eating and you'll never get well. You know, your life and your happiness is directly related to your lifestyle. And mom and dad and the family tree. After the surgery, my family doctor told me to wait a year until I tried a raw juice. You're asking a medical doctor about health, honey. Duh. I tried it about 8 months after the surgery and started to feel very nauseous. From what I have understood, nausea could never be a part of the detox symptoms. That's not true. And nausea wouldn't be kidneys per se. Could, but I doubt it seriously. This is probably your GI tract, stomach and liver and stuff like that. You don't want to start making things up. And now you're buying into this surgery, or this surgeon who doesn't know his butt from a hole in the ground when it comes to raw foods. I mean, if he's a raw food surgeon, I apologize, but I doubt it. So, or he wouldn't have said that to you. He would have said, you need to jump on raw foods yesterday, not in a year from now, while you're eating ash foods and breaking down the job he just did for you. You're full of fear, dear. Get rid of it. Become the woman warrior that you are. Why do you get a tumor in your body? That's what everybody's asking. That's why you're on this channel, dear one. It's the lymphatic system. It's your kidneys. Right where you had the problem. It's in your face, literally. So I waited till exactly 1 year later to the day to do another raw juice cleanse. I used intermittent fast. I can't believe he held you off for that time. I can't believe you did that. Then I raw juiced and drank lemon water through the fasting part of 16 hours per day. It went well. I had no nausea, blah, 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 blah. So do I buy the herbs from you and start on them? Should I buy the kit? That's up to you, honey. I can't tell you. But if it was me, that's where you're talking to me. That's where I would be going. You're so discouraged for what? You haven't even started on a detox program yet. You're just hanging about there going, well, I don't know. Or what are you doing in the meantime? What's your diet? Is it raw? What are you doing now? I mean, immediately after the surgery, what did you do? You see what I'm saying, guys? We've got to educate and educate and educate because these poor souls don't know what they're doing. And that medical doctor felt she was trying the master cleanse, but filled her full of fear because he doesn't understand where the cyst comes from. That's amazing to me, isn't it? You guys know. So if there's a bunch of cells and only two major fluids outside of H2O, what kind of fluid would that be then? Didn't look blood, did it? When you see the little pustulas and that, didn't blood coming out? So what's left? What's left? There's only one thing left. I don't know. I guess I could guess something else. I live in a fifth wheel in British Columbia, Canada. No kidding. I lived in a fifth wheel for years. No kidding. I was planning on taking my fifth wheel to Mexico so that I would have access to more real tropical fruit. Not a bad idea. Just as long as you have protection, and got to be careful there. Do you think sunshine and fresh fruit would help me? No. No, I don't. I think you got to be very careful with that. You want to be very careful eating the fruit and be careful with that sun. Honey, come on, man. Can I buy the adrenal and kidney remedies and maybe just take half at a time so it's not? Well, you can. I would buy the first kit. Start out with half dosages if you feel that way, but I wouldn't. You've been a year already. How long you wait? What are you waiting for? You could have another cyst growing right now, dear one. No. I don't wait. Waiting is for people that are full of fear and they need someone to tell them what to do. Grab your woman warrior, lady. You're a woman warrior, I can tell in the first part, but as I see you continuing to go on, you're sucking yourself in your own fear. It's like, this guy didn't know what you knew about the juice and you're asking him his opinion? Really lost and I don't know where to start. All I know is that I absolutely believe you and I know my kidneys aren't working from all of my symptoms. Just a little advice would help me, and there you got it, my dear. Please email me back. I don't email, but I do YouTube. I don't know, maybe someone got a hold of you, I don't know. Jen B takes these off. Oh, this is pretty cool. This is leaking heart valve. This is the Middle East. Well, if you have a leaking heart valve, you have any like tricuspid or mitral valve, where you have any regurgitation, anything, think about strengthening. And remember, when you're acidic in these tissues, that would mean that you would have to have one of two things. Kidneys not filtering, or genetic weakness in those tissues, because remember, in a genetically weakened tissue, the lymphatic system is already more stagnant than the rest of the body. So any of those two or both, and what happens in stagnation, we were talking about it with Marcy here, that the body will rob calcium out of its structure. Well, in looking at structure of heart valves and all of this, we're looking at calcium as a major role in connective tissue and the like. So when you see the weaknesses, you want to go and start strengthening that in two ways. Strengthening it cellularly, which would mean to get the lymphatic system cleaning out of the heart, because that leads to congestive heart failure. And at the same time, I'd be looking at the parathyroid and calcium utilization. I'd be fixing my adrenals and kidneys connection, of course, and working that way. My nephew was just diagnosed with leaking heart valve. The doctors told us that there is nothing to do because he was born with that. Strengthen. Cells can be strengthened in the womb, guys. Cells can be strengthened anywhere. Thank you. Holy crap. Oh, let's just wait. I love that one. Can't do anything about it. It was a birth defect. Really? Doesn't matter if you're in or out. Cells regenerate. Cells are alive. Get me? I mean, come on. My question to you is if it's curable. Absolutely. I want to know if the heart can repair itself. Absolutely. Matter of fact, the medical community itself came out here a few years ago, because remember, the liver was the only regenerable tissue in the body for how long medically? Now the heart can. Now the heart can regenerate itself. Really? Every tissue in your body can, guys. Every tissue. At their pace, it'll be 1,000 years before they realize the neurological tissue can regenerate itself. That's the booger bear right there. Like congenital defect. Absolutely. And it's not something that developed during his life. Absolutely. Because it's something that developed. I mean, you have to just understand that everything is within the matrix of time and creation, and within the matrix of consciousness. So at any given time, you can affect action within tissue by using chemistry at this level, thought at another level, and emotions at another level. But that's how you initiate response mechanisms and movement, whether it's to one side or another of the poles. So whatever energetic move that you go on tissue, it's going to either pull it to the negative side or the acidic side, or it's going to pull it to the positive or alkaline side. If you want to be well, you need to alkalize. You need to pull to the the hydrated side or the alkaline side, and that is an electron-dominant electrolyte. Rich food, which is going to be your fruits, your berries, and your melons, and your vegetables, basically, and that's about the only ones that are. Everything else, when you get into your grains, now you get into complex foods, where the chemistry is more complex. And when you complex even alkaline chemistry, it can have a more acidic effect on you. But, but they come more acid-ash foods then, especially when you complex the nitrogen side, which is the amino acid side or the protein side. Let me just check on the time for a minute, so I make sure that, there we go. Since I forgot to turn up my clock an hour. Jerome, hello the team. Yeah, I'm Belgium. I'm Seoul. 29 years young, man. How are you? And I had a damn. Here's a young Belgian dude, 29 years old, who had chemo and radiation when he was 8. And he's still alive, thank God. I began to change food about a year ago, now 2 months only fruits. I took a lot of herbs to heal my kidneys. Oh, good. Oh, these herbs in France. Like 10 cures of only this mix, but I can't see result. Not a good mix. Some people have herbal formulas out, but they ain't worth a hoot. So I don't know. I don't know. I can only speak for mine. Mine kick butt. 1 to 4 concentrates. Can't find that out there. Ask a company what their concentrates are, what your percentages are. But ours is 1 to 4. That's the most you're going to get unless you do the MediHerb thing. And that's getting up to 1 to 2, 1 to 1, and that's your blow dry, and then you're doing 2 or 3 phases to get there. And then I don't want to lose too much of consciousness there, to be honest with you. And you can only get so powerful anyway. At 1 to 4, you got a pretty powerful. Most of you guys can testify the power of the herb and the effect on the body with it. You can get too powerful. It's a rhythm, and it's a total focus. You can't just take herbs and eat an acid-ash diet. You need an alkaline-ash diet, an energetic diet to go along with the herbs, and then everybody's working together. So in a harmonious way, taking botanicals with a diet change is essential. I don't know what else would be that way, I'm wondering if it's the good way. My creatinine doesn't move at 1.3. Then I don't like those herbs. 1.3 is obviously way too high. You want half of that. Actually less. You want 0.5. When you see 0.6, 0.7 creatinine, you're creeping. And then it starts creeping faster to 8 to 9.9. Then you hit 1 and 1.3. And it's what's ironically, most labs have moved their high-end normal from 0.99 to 1.3, 1.25. It's like, what are you guys doing? You want to bring that down. But, let the patient sit there, because medical doctors are now letting you sit there with more kidney problems longer because of that. If you're under 1.3, you're okay to a medical doctor. As long as the lab didn't take it abnormal, a little too high, you're okay. Really? That's the kind of thinking you want in a practitioner? I don't think so. So, I would do this. I'd go on a grape diet for about 40 days or 30 days, whatever you can go on, man, and do some dry fasting, 24, 36-hour intermittent in that area. And I'd also do the herbs, 2 kidney formulas, 1 capsule, 1 tincture, and go after your adrenal glands. It might not hurt to take a look at that pituitary. All right? Just a thing here. And I would probably try our herbs or someone else's that, get away from theirs. Obviously, you didn't see a response from them. Not knocking them, don't know them. But obviously, I'd try something else. But you need that creatinine down, baby. Down. And if you're not budging, then what you're doing isn't right. Not working for you. So kick it up another notch. Kick it up another notch, man. Do the emerald thing. Still any sediments in my urine. My tension, blood pressure was at 14 over 9. Oh, 140 over 90. Holy crap. Now it's 100 over 85. Okay, so I want you to think about this, okay? You got some serious things. Think about this, Jerome. You're 100 over 85. Now, you're only showing me one arm, right? So you want to check both arms, right? Blood pressure is what? Systolic, top number, adrenal glands, top, on top of the kidneys. Bottom number, diastolic, kidney pressure, kidneys, bottom. All right? So your bottom number is 85. You got kidney problems, dude. Big time. Obviously, 1.3 creatinine and a high diastolic. No way. So now you got a problem here. You got 100. You brought your adrenal inflammation down a little bit. But now you're at 100 over 85. Holy moly. All right, so you're already low. 120 is textbook. So you're 20 points too low already on that side. But you're 20 points too high on the kidney. Your kidney are way too high. You should be 60. Well, you're only 100 on the top with a high blood pressure on the bottom. That's the problem. So when I go after that kidney and I'm pulling that pressure down in that kidney, you're at 100. It's coming down with it. You're at 100. You're going to see 80s, bro. That's your problem in the first place. That's why the chemo and radiation in the first place. You were born with serious adrenal and kidney problems. But that's why we're fighting. It's why you guys are fighting these problems, dudes. These kidneys and adrenals, you guys got to work on them big time. I don't care what it takes. If you're not successful with one herb company, try another. But, yeah, your blood pressure is way out of whack. Way out of whack. It's kidneys. Your adrenals, just what the adrenals do. As your kidneys come down, so does your... So you just went from 90 to 85, and your adrenals dropped from 140 to 100. Holy moly. So that's some serious adrenal weaknesses, dear man. And serious kidneys. You want to work on them. Pull your eyes and look, baby. And also, look at the other side, because you got a kidney and adrenal on the other side. And I began to be tired. No kidding. No kidding. You're going to have major fatigue with this one. You need to use licorice root with your protocols. You're going to have to use an adrenal, maybe even a 400 milligram glandular for a while. Wake up these adrenal glands. You know, I would have one of us write I write all the protocols here when you go through that doorway. I write them. But you need to have some of us fix you up with something because you got a problem here, man. And with that, you've got a lymphatic system that's got to be a you-know-what house mess, and you've been on chemo and radiation. You need to do a little more involvement with us or with somebody. Hook yourself up with one of our detoxification specialists or something and get yourself well here, man. I don't like what I'm seeing here and there from you. Samuel. Hey, Sam. My mother was diagnosed with colon cancer, had the tumor removed. 6 months later, large polyps had formed. Have heard fruit feeds cancer or tumors. La-di-da-di-da-di-da. Gross. You know, the sad thing about that is that was a rumor. And it was like, really? How stupid. I mean, really stupid, bro. I tell you what, your mom needs to go on a fruit diet like yesterday. I would put her on a grape diet of about 40 days. And you want to get her kidneys filtering yesterday. And this is just what I've been talking about. You don't fix the problem, you have your tumors removed. Hello, what's going to come back on you? Because you're agglomerated. You have lymph stagnation. And these are lymphomas. These are tumors that are formed when the lymph fluids can't move freely through the kidneys and filter properly. She's stagnant. But that's scary because she's your what? Mother. So that doesn't fit well with you, dude. I'd be looking at myself. I'd be going out and getting my eyes of my mom and myself. I'd be looking at my kidneys and adrenals, my lymph systems, and I'd be having my mother look at these YouTube videos and telling her she needs to get herself going because she'll just have more polyps and another tumor. Which is what we say, if you don't fix the lymphatic problem, the stagnation, removing just buys you a little more time. The problem then with her having colon surgery is what? Adhesions and scar tissue, guys. Adhesions and scar tissue. So your mama needs to really hit on this big time so she doesn't get adhesions, because she'll be in for another surgery. And now you got the polyps. And it's just, you got to stop this. How do you stop the onslaught of tumor formation and polyp formation? You fix the lymph system. You understand that the kidneys and the skin are eliminative organs. You get your kidneys filtering and get your butt sweating. You're going to the thyroid to sweat more, and you're going to kidneys and the adrenal glands to get filtration. Dry fast, I mean, you hit it the best you can. No, we're all into this. On this site, we're into this. And don't buy into the fruit, because if you buy into that, you're buying into the biggest lie ever perpetrated. Fruits don't have anything to do but help. The only way, how can this, all right, there is a way that a fruit can make a tumor grow. But it's going to be the same with vegetables too. Well, it's not just fruit. But fruit can have a more active role. Why? And how? Well, fruit is astringent and the most electrical food on the planet, right? So it's going to start astringing like a lymphatic formula, right? So when you start astringing and you start using a lymphatic formula, whoa, wait a minute, we have a blockage. Uh-oh. That's why we backed up on using two lymphatic formulas the first month. Because, we've got a door closed and we can't hit too hard on a system with the door closed, right? And I've been talking about this a long time. That would be the only way a fruit diet would make a tumor grow, and I wouldn't even focus on it, because you've got to open up the doors. So the fruit is key to opening up and removing tumors. It is key. Not vegetables. You can carrot juice to hell freezes over and you're not going to affect tumors very well. That's what I did. Carrot juice fast. Didn't know any better until I started waking up and going, wait a minute. We're not herbivores. There's no astringents in carrot juice. Who the hell came up with carrot juice? And Jensen proved that. Remember, 3 months on carrot juice fast didn't affect his cancer whatsoever. And I'm very confused, please help, trying to break the mechanism in her body that keeps making these polyps, which eventually turn malignant. The mechanism is the lymph, these are lymphomas, and the mechanism is your kidneys and adrenal glands both. Got to get filtration, got to see filtration in the urine, got to see sediment in the urine. Go to our other videos talking about this. Very important for your mama to get this and get her kidneys filtering. She'll stop it, back it up, and then all these will come out. If I'm your mom, Sam, I'm on a 20 to 30 day grape diet right now. I'm on kidney formulas. I'm on a dry fast during this. I'm on adrenal formulas. I'm going after my GI tract with the GI broom. I'm going to start pulling and opening up the doors. I'm going to make sure my basal temperatures under my arm are close to 98, because I'm going to sweat my butt off. I'm opening the doors. She's locked. So you've got to open. You can't lock her more, or bye-bye mama in the future. And you want to keep the scar tissue and adhesions from forming too much. I mean, this is another big deal she faces. Once you go under the knife, man, you're facing other factors here under an acidic sky. You're facing adhesion, scar tissue, all of this stuff. And it just, more surgeries, more problems. And always endless. Never get that final, I'm healthy, I'm fine again. Never. Because you're not focusing on the cause of problems. But that's allopathy. Look at this. This is Vlad. He's 26 years. Look at all the 20-year-olds, guys. He is diagnosed with MGUS. This is a pre-myeloma or so. And my doctor told me I should go for regular checkups every 3 months and see whether it's advancing or not. I never heard of MGUS. I had an MG in the US once, though. I had a couple of little midgets years and years ago. Boy, those are little. I hit a telephone pole with one. It was raining real hard, and I think probably it was at a party. And I can feel that one. But the same thing, man. You're dealing in your lymphatic system. Get your kidneys filtering. Get your kidneys filtering. Get all your lymph system moving, and you'll be fine. It is quite difficult having to wait and do nothing about it. But don't wait and do something about it. I agree with you. Don't sit there and wait and listen to him and go, well, let's check it every so often. Well, nothing stays the same. I've said this before. Chemistry and physics, they're not static sciences. There's always flux. There's always activity, no matter how minute. My opinion. Nothing is totally static or homeogenic, so to speak, or at what we would call a homeostasis, in other words. I don't think you can reach that homeostatic. It is quite difficult because you're always waxing and waning. You're always moving, breathing. It is quite difficult having to wait and do nothing about it. Is there any chance you could talk a little about the illness and whether or not there's or a diet? Absolutely, diets and stuff. You're going to open up your lymphatic system. You're going to open up your kidneys. Just what we've been talking about to the lady before you there. Same thing. We're all suffering from the same thing, guys. Different names, different spots, different things. Medical doctors come with all kinds of abbreviations and stuff like that. Absolutely. Okay. What's the real problem? The lymphatic system. Looking at myeloma or something else that is down the regression of the disease. Get rid of the disease thinking, my friend, and learn about your lymphatic system and you will be well. Oh my God. All right, I got one more. Here's another one, guys. This is Kathy. And hi there. How? My mother had breast cancer stage 3 and tumor was removed with no cancer in her lymph. That's still lymph, believe it or not. She might not have had any cells in the lymph node yet, but that's still lymph. Her tumor was lymph. She is now awaiting radiotherapy and has been told she will be put on tamoxifen for 5 years. You know, Kathy, I'm glad you wrote this in there because I'm glad you guys are watching out for your parents and stuff. It's funny we have to do that. But tamoxifen, the World Health Organization claims that tamoxifen is a carcinogen. Well, wait a minute. Tamoxifen is an estrogen blocker. There's tamoxifen and then there's another one, Rubidex. These are estrogen blockers. So whenever you inhibit anything in the body, you're inhibiting an endocrine gland function. The endocrine glands are your bosses that control everything. You don't want to inhibit anything. Estrogen doesn't cause a tumor. Not on your life. And estrogen is a light acid. They're going to shoot you with radiation, which is a hotter acid, along with, you didn't mention chemo. So, again, your mother needs to wake up from this. Don't burn. There's no such thing as burning it out and cleaning it out. All it does is kill more and damage more cells to create more lymphatic problems. The cell is not the problem. It is the acids damaging the cell that's a problem. If you have a few cells damaged, live with it. The body will clean them out. Fix the system, excuse me, that's damaging the cells. This is vital. Because if you don't fix that system, then don't bitch. You know, if you've got to remove the acids, remember there's only two sides of chemistry and there's only two fluid-based systems interstitially that are in the interstitial spaces wrapped around the cells. Hello. Medical doctors, hello. Anybody with a brain out there, hello. That's the problem. When you're thinking too much, there's no room for people to get truth into you. And then anybody that tries, you pull them off because you know better. No, it's not how it works. That's ego, and that's your biggest trap to fall in. You know, the sad thing about being a medical doctor, it can be one of your biggest traps and a big karma maker for you. Yeah, that you want to rethink. Not worth it, repeating this journey over and over again too many times. So the tamoxifen is seriously bad mistake. And then having radiation therapy is a seriously bad mistake. You want to really fix the problem. You're just trying to treat the symptom. You're allowed to just throw anything on the fire hoping it'll cure you, and nothing ever does because you haven't done anything to fix the problem. Make sense? Yeah. We are really concerned about this drug. You kidding me? Absolutely. Look it up. World Health Organization, the WHO, considers it a carcinogen. Oh, really? So a carcinogen is a cancer-causing chemistry. Oh, but the medical doctors in America haven't agreed with that yet. So here, you can take it. You see where I'm going, guys? Take your powers back. Get awareness going here. Look at these videos. Learn the truth of life. Learn the truth about chemistry, the acid and the base. Foods are acid forming or alkaline forming. Learn that. Certain foods are not foods. They're foreign chemistry to the human body. Understand the Homo sapien is a frugivore species, not an omnivore species. We're not dogs, hogs, bears, and chickens. Those are omnivores. Humans don't look like omnivores. Only medical doctors are willing to call us omnivores. We're frugivores. Sorry, like it or not. And we're supposed to be the more advanced frugivores on the planet, but the primates outdo us every day. At least they don't kill each other and hurt each other. I mean, there's some that do. Those are the chimpanzees that were fed the meats and all that. They're killing each other now. Abnormal. That's what humans are doing, eating meats, killing each other. It makes us violent. There's been plenty of studies about that. But let's do the paleo diet. Ugh. We're a gentle, loving species if we get away from the meat and eat the fruit. We are the spiritual species on the planet that can help the rest of the species, but no. The other species are doing better than we are. I mean, but they don't have the development of the mind that we have to develop. They don't have that level yet, that self-awareness that gives us a little more freedom to do things. So, Kathy in Ireland. You got a lot of Irish friends. Look up Maggie. Maggie May. Guys, I love you guys. Enjoy your road to Wellville. You're all blessed. I feel blessed that have this information and that we're putting it out there and educating the humans on this planet. And there's so many of you. My heart is just open to so many of you beautiful beings that have got your health back. That's what it's all about, to feel good and to be happy. You know, this is your journey. You're the one driving your car, and if it's not, drive your car. Kick everybody else out of your vehicle, and you grab the wheel. In other words, quit thinking, quit desiring, quit giving other people your power. If you love someone and they don't love you back, go to someone else. If you love someone, use divine love. Personal love means you love someone because you want something back from them. That's a deficiency in you, not them. So when you look at personal love, it's full of emotional traps. That's your astral body. And a lot of you are very spiritual. You're opening up and awakening up, and so you're going to go through these emotional doors. Marcy, that's her favorite side to talk about. But you don't want to give it power. You don't want to give your emotional side power. That's why you pull yourself in the now. Giving your bodies power is losing your attention in your bodies. And if you lose your attention in your bodies, you have none for yourself to be awake and aware. You're lost in your emotions. You're lost in your thoughts. You're lost in your desires. You're lost in your drama, your dharma. Pull back from that and free yourself. Free yourself from that mind, from thoughts. You still use the mind, you still think, but learn how to put it out there where you're free. You can listen without following thoughts. It takes practice, but start practicing. Take this next week and the weekend and just hang out and be. Start listening within. See if you can hear the inner music. Or another technique is, of course, to listen outwardly. Try to listen where you're not there. All you're doing is just being in the moment listening. You will find yourself expanding endlessly. Try fun techniques. There's a lot of fun techniques, you know. But remember, you're that point of view that's looking through the hourglass of the mind, the emotional components and the physical body. Free yourself up from these torments and you'll be happy. And then your love for someone will be there because they're cool. You like their mannerisms, you like the way they look, you like their body parts or whatever, you know. But you don't want to love someone because you need them or something about them you need. You don't need anything. The real you. Your bodies need shelter and protection, maybe an energetic source, of course. But you do not need anything. You who have, when you pull your attention back to yourself, to the present moment, you will be fulfilled. Cliche as it sounds. Nirvana, ecstasy, joy will all be yours because you found your freedom and yourself, which has been hiding behind thought and emotions. Your own thoughts and your own desires and emotions. No one told you this. When they brought you here, they told you to start thinking, planning, desiring. So they locked you into this drama here. You're into the movie. Some of you are tired of watching the movies and you want to go home or you want to wake up to a higher level of expression. There's only one way to do it. Strap yourself in. Become the observer. Stop thinking, stop planning, stop desiring, start listening. Remember, stop thinking and stop talking, and there's nothing you won't know. That's a Phoebe Quant special. And if you want to learn more, ask Phoebe Quant. There's a master for you. But love you guys so much, and thanks for taking on all this. This is a very powerful level of healing and spirituality, and it comes with karmic runoffs. So whatever you see, whatever you experience, talk to the hand. The face isn't listening. Pull yourself in the now and let the spirit, the prana, the life force, whatever you call it, clean you. And whatever you see, whatever you experience, don't hold on to, let it go. Let it go. Whatever you see, let it go. Let it go. It doesn't matter. Nothing matters anymore. There's only one thing that matters, and that's your awareness, your freedom, your joy, your happiness. And there's only one way to get it. And no one else holds the key. No one else holds the key. You're the only key holder, guys. Love you.